Tadpole Positioning System, sponsored by Assistive Technology for Kansans and Tiny K, Kansas Infant Toddler Services. Demonstrated by Rhonda Etter.
Many young children with physical disabilities have difficulty maintaining or changing different positions. Their physical or occupational therapists may recommend specialized equipment to help them be positioned best for rest or play. This is the Tumble Forms Tadpole Positioning System. It has lots of different pieces and is really designed for use by infants, toddlers, and preschoolers. It's made out of high-density foam that's covered with some antimicrobial vinyl. The Tadpole Positioning System consists of several different pieces. This is the base that the other components are velcroed onto. There are a couple of rainbow shapes like this, a tray with a mirror on it, a log roll and a small half round, and a seating wedge. I'm going to show you several different ways the tadpole can be put together to support different kinds of positioning. Kindly, Bobby Jack has agreed to model these different positions for us. In this configuration, the tadpole can support supine positioning. In the supine position, the child can see their environment and watch their hands as they play. Supine positioning supports arm movements towards midline, hand touching, and hand-to-mouth activities. Hanging a toy above the child in this position can be great stimulation. In this configuration, the tadpole is set up to support sideline. As you can see, the small half round is supporting the larger half round. And there's a positioning strap that can be moved at any place along the length of the base unit. Bobby Jack can be positioned in the sideline and supported well. Sideline is a great rest position for children who have a little asymmetry or some muscle imbalance when they lay on their tummies or on their backs. When a child is well supported in a sideline position, it's easy to use the hands for play. You can also set the tray with the mirror, and the child can be entertained as they are lying. In this configuration, the tadpole is set up to support prone positioning. If extra support is needed, the hip strap can be used to stabilize the hip area. For most children, the prone position helps them strengthen the muscles in their necks, backs, shoulder, and hips. In this position, the child can practice using their arms for weight bearing and can explore toys by reaching and grasping. Keep in mind that this position can be difficult for children to stay in for long periods of time. The tadpole can be used to position for sitting when it's configured like this. Sitting is a great position for children to see and interact with their environments. The contoured back provides a 75-degree angle for support, or the flat side can provide a more upright 90-degree support. Let's go with 75 for Bobby Jack. Pull our seat belts in place. Velcro it into position. Nice and firm across the hips. Then the tray can be put into place for extra support when it's needed, and to position the hands up in an area for play. The tadpole can be put together in other ways too. Some ways to help provide vestibular stimulation, some ways to help with bronchial drainage, just as creative as your therapist can be. Here's a tip. Once your physical therapist has all the pieces set up just exactly right for your child, you might want to take a picture so you can remember how the pieces go back together. Here's a tip. The Tadpole is easy to clean with a damp cloth and common household disinfectants. The Tadpole comes with this great net tape to carry it around, but it can be kind of tricky to get all those pieces in there. Try putting the stack together like this, and then they'll all fit inside.
Demonstrated by Rhonda Etter, AT Specialist. Tumble Forms, Inc., www.tumbleforms.com, 800-475-5036. For questions and support, contact your AT Access site, 800-526-3648, or 800-KAN-DO-IT. Contact ATK KU staff if you would like to be involved or have suggestions for inventory, 620-421-8367. If you want to see other items like the one demonstrated, contact the ATK Device Loan System, 785-827-9383. June 13, 2010.